Life in the gap is very uncomfortable, and what that means is that part of your revenue is coming through fee-for-service and part of it is coming through other forms of payment. And I think it really is about understanding where the revenue comes from and what are those incentives, and then how does your care model within your hospitals or your clinics or more broadly into your communities have to change. I think the key issues for hospital leaders are to, first of all, have a very objective and brutally honest assessment of their own strengths and weaknesses. And really to ask yourself the question, what is going to make your hospital or health system relevant to payers and to populations in the future? I think once those questions have been answered, you're well on your way to deciding what path is right for you. Well, the good news about the report is it assumes that every hospital and health system, no matter how sophisticated, needs to continue to progress to be more relevant in this new age. And what it does is it starts with some very specific questions that each hospital or health system should ask themselves. And then it suggests 1, 2, 3, 4 paths that can be followed by a hospital based upon the answers to those questions. So it's not a cookbook, certainly, but it suggests some ways that hospitals and health systems can continue to meet their missions, be relevant, be sustainable, and really provide better health to the people they serve. We will continue to advocate for fair payment, reduction of complexity, regulation, compliance issues that are really crushing our industry in many respects. At the same time, we're going to be pulling stories out of the field, stories where hospitals and health systems are finding new and better ways to provide high quality care at lower cost. You know, I've never been more optimistic about this field, and I'm optimistic about hospitals to the extent that they really accept the responsibility to redefine, to change, to be relevant. And hospital is going to be redefined not just as a place, but really as a way to organize a better healthcare system for communities and ultimately for this country.